Hi friends, today our topic is carpal tunnel syndrome. What is carpal tunnel syndrome? It is the entrapment neuropathy of median nerve within the carpal tunnel. That means it is the entrapment of median nerve within the carpal tunnel. What is carpal tunnel? Carpal tunnel is the fibro-osseous tunnel. Fibro-osseous tunnel. That means it is made up of fibrous tissue as well as osseous, that is bony tissue. It is made up of bones and the fibrous tissue, that is the transverse carpal ligament. I will tell you some intro about the fibro-osseous tunnel. It is a U-shaped tunnel. It has a base which is formed by the carpal bones, and it has a roof which is formed by the transverse carpal ligament. It is also called anterior annular ligament. This base is formed by the carpal bones. It is formed by on lateral side. There are two bones from proximal to distal. There are scaphoid as well as trapezium. And on medial side or on ulnar side, there are pisiform and the hamate. From proximal to distal, it is scaphoid, and it is trapezium. And on medial side, that is ulnar side, from proximal to distal, it is pisiform and it is hamate. And this roof is transverse carpal ligament. If this is the wrist, if from lateral side there are scaphoid and there are your trapezium. On medial side there is pisiform, and distal to the medial side there is hamate, and this roof. Actually, this transverse carpal ligament, it bridges the anterior concavity of the carpal tunnel, and it forms its roof. It is a small canal. It is roughly 1 inch in diameter, and it is relatively, it has a smaller cross section in females. In females, it has a little, smaller cross section than males. That is why it is more common in females. There are some other reasons I will tell you later on. So now this carpal tunnel, what does it contain? It contains 10 occupants. I am going to present it in a simpler way. So I am telling you that there are 10 occupants. There are 10 people living in this tunnel. Among the 10 occupants, you just have to remember this number 4411, and that is it. What is this for? 4 tendons of flexor digitorum superficialis, 4 tendons of flexor digitorum profundus, 1 tendon of flexor pollicis longus, and 1 median nerve. Since it goes to the thumb, it flexes the distal interphalangeal joint of the thumb. That is why it is called pollicis, flexor pollicis. Pollicis means thumb. So these are its occupants. So you just think of it. It is relatively. It has a little smaller cross section, and there are various more people in less space. It is accommodating. That is why any pathology related to any of the tendons or any soft tissue structure within this tunnel, any pathology can compress the median nerve, and it can result in result within the carpal tunnel syndrome. So what are its clinical pressures? First, I will tell you pressures. Normal on an average, it is 13 mm of Hg. You just remember this figure, 13 mm of Hg is normal pressure. And if it is greater than 30 mm of Hg, it is diagnostic of carpal tunnel syndrome. And it also varies. It is not all times you are 13. In extreme flexion, it goes up to 42 mm of Hg, 42 mm of Hg in wrist flexion, and it is roughly 33 mm of Hg in wrist extension. These pressures have been measured. These have been made by the pressure transducer catheter within the carpal tunnel. So what are its clinical features? Etiology, I am going to present it. You just have to watch the another lecture for etiology, because I have explained, I have described its etiology in detail. So I request you to watch another video for the etiology of the carpal tunnel. I think that is my second or third video of the lecture series. So what are its symptoms? Symptoms of the carpal tunnel syndrome. Number 1, ape hand deformity. Ape hand deformity. Number 2, loss of hand dexterity. Number 3, thenar atrophy. Number 4, paresthesia in lateral 3½ fingers. Number 5, it is pain, nocturnal pain. Number 6, clumsiness in hand movements. Now I will explain them one by one. Ape thumb deformity. Ape thumb. What is ape thumb? Ape thumb is the inability to abduct or oppose the thumb. Inability to abduct or oppose the thumb. Ape thumb deformity. You are not able to abduct or oppose the thumb. Shall I erase it? Ape thumb deformity. That means loss of abduction and opposition of thumb. You are neither able to bring the thumb perpendicular to the palmar surface, nor are you able to swing the first metacarpal bone, first metacarpal across the palmar surface so that it can touch the distal phalanx of the fifth finger or little finger. This is opposition, this is abduction, perpendicular, this is opposition. So this is ape thumb deformity. Second, loss of dexterity. Dexterity means loss of dexterity means the eye-hand coordination. Or you can call it the loss of the scaled movements, loss of dexterity. Number third, loss of thenar atrophy. You know your thenar muscles, they undergo atrophy. So the hand looks more or less like the simian hand. You know, simians, they don't have this thenar muscle. Thenar eminence gets lost, so that the thumb comes in the same plane, this palmar plane, this plane as your rest of the fingers. You have loss of opposition, you have loss of abduction, and also you have the loss of atrophy of the thenar eminence. You know your this median now, it gives sensory supply to the thumb, this index, middle, and lateral half of ring finger. It gives motor supply to the medial two lumbricals, to the lateral two lumbricals. Motor supply, you just remember median lobe. Median nerve gives motor innervation to the L means lumbricals, lateral two lumbricals, Apponian pollicis, abductor pollicis brevis, flexor pollicis brevis. These are the four muscles which